This segment on Bridge Street is sponsored by Aging Advocates CNY.
This month we focus plenty on mental health, but May is also Better Hearing Month.
And hearing loss can have a tremendous impact on our senior population. Here to tell us more are Aging Advocates founder Melissa Murphy and Dr. Nicole Anzalone of Syracuse Hearing Solutions. Good morning to you both. And Melissa, I'll start with you. Why is hearing loss such a big concern for the senior population?
Sure. So at Aging Advocates, we are care managers looking at our client's entire picture, and often the correlation between the ear and their quality of life gets overlooked. So a few examples would be their risk for balance, dizziness, fall risk, also social isolation if they are experiencing hearing loss, becoming more reclusive from their activities, their engagement with their friends, and also the correlation between overall cognition.
Right. There's lots of studies out there now that show the correlation between hearing loss and the increased number of falls and cognitive decline, early cognitive decline. So studies are showing that you are 1.5 times more likely to have cognitive decline with hearing loss as compared to normal hearing peers. And with falls, you're 3 times more likely to fall with just a mild hearing loss as compared to normal hearing peers. So that's significant in terms of how it affects quality of life. You know, falls are the #1 cause of fatalities amongst the senior population, so it's really, really important.
What are some red flags that we need to look out for then when looking at our aging population?
So in terms of falls or increased risk of falling, if you have a caregiver that sees one of their clients and their clients say, well, I'm afraid to lay down flat, or I'm afraid to turn to different positions because that makes me dizzy. If they're veering to one particular side or bracing themselves or have a very cautious gait when they walk. So that would mean that they should be tested or screened for fall risks.
I would assume, Melissa, that there can be some pushback, right, with, well, you should get your hearing checked. No, I'm fine, I'm fine. So talk us through the process, I guess, of getting your hearing checked. And if there is an issue, what are some things that can be done to get that issue resolved?
Well, in terms of cognition or even social isolation and depression, having those conversations and wanting them to be screened can be, oh, so scary, so overwhelming. They're thinking neurologist, MRI. So to actually see your audiologist, to have your ears checked is so much less intimidating. So it is a great referral that sometimes does get overlooked by the primary care. So again, having an aging life care manager really advocating for that to be checked. And also at Syracuse Hearing Solutions, they have this amazing product that tests for changes in cognition right in the office, which is very non-invasive and a great way to check somebody's baseline and if there is a change year over year without having any invasive MRI or any cognitive testing.
Yeah, so it's a 10-minute test. It's called a CogniView, and you sit in front of a computer screen, and it tests for different memory issues, processing speed, reaction time, all these modalities that are related to and can be related to hearing loss and early cognitive decline. So it's really quick, and we will do a hearing test as well just to look at the relationship there. And so we can make sure the patients are in proper hands and get the treatment, because hearing loss is modifiable, early cognitive decline is modifiable, so if you catch it early, there are some things you could do to treat that.
All right, is it as simple as getting a hearing aid after that then?
In some cases, actually in many cases, if someone has a hearing loss, the hearing aid can actually help reduce the number of falls and reduce early cognitive decline.
Have you got your hearing tested lately? No?
Okay. Important stuff, ladies. Thank you so much for coming on. Again, you can find out more by visiting agingadvocatescny.com. You can also find them on Facebook. If you'd like to learn more about Syracuse Hearing Solutions, visit syracusehearingsolutions.com. This segment has been sponsored by Aging Advocates CNY.